Good evening, one and all. I'm so happy to welcome to our exciting webinar on Operation Theatre Technology, each one of you, especially our distinguished guest, Dr. George Matthews. My name is Preeta Harikrishnan, and I am the Deputy Manager of Admissions at the Kochi campus. I will be your moderator for today's session. Thank you all for joining once again as we dive into the fascinating world of Operation Theatre Technology. Before we begin, I want you to remind everyone to utilize the chat box for any questions or comments you may have throughout the presentation. We'll address all queries during the question answer session at the end. Now it is my great honor to introduce our esteemed guest, Dr. George Matthews John. Dr. George is an associate professor in the Department of General Surgery at Amrita Institute of Medical Sciences in Kochi. In addition to his teaching role, he is the program in charge for the B.Sc in Operation Theatre Technology. His contributions extend beyond the classroom as he serves as a surgical disciplines representative and is an active member of the curriculum committee at the Amrita School of Medicine. Furthermore, Dr. George Matthews is a coordinator and a member of the Internal Quality Assurance Cell at AIIMS Kochi. Now let's get started. I invited Dr. George Matthews to share his valuable insights on the topic Operation Theatre Technology, its scope and opportunities. Welcome, sir, to this webinar.
Thank you very much. It's indeed a great opportunity to be speaking with all the prospective students who are here. And of course, when you talk about the future generations, of course, nowadays with the advent of technology, the future generation needs information at their fingertips. And before they embark on a career which is going to determine what the rest of the life is going to be, it's very apt that they should be knowing exactly where they are venturing into. That is why we are embarking on this webinar series. And today I'll be talking to you about the department I head. And then, of course, what are the prospects for you and how it goes about in this institution. So before I start off, again, I would like to thank Madam. And it is indeed an honor that I am able to address the coming generation again. And we've been doing this every year, and we've seen that we've got very good students who have excelled in every aspect of their academic life, extracurricular life, and they've passed out with great flying colors and they've been employed in different parts. So at the outset, again, uh, I'm Dr. George Matthews John. I'm professor at the Department of General Surgery and I head the surgical unit 2 here. As Preeta Madam had told you always, I have been at the forefront of saying that the future generation comes forward in a way which is going to be useful to our nation. And of course, in the long run, when they go further and further, they'll be our torchbearers and stars which will be shining in the world also. So at the outset, I would like to put my talk into 3 phases. That is how you're going to enter into this program, that is the B.Sc Operation Theatre Technology, and what are the future prospects for this program, which is calling you or beckoning you to come into this program. Second thing is, what are you going to face when you come here as a student, as a B.Sc Operation Theatre Technology student? And third thing is, what are your prospects which is lying ahead after you finish this course in this institution? So first of all, I would like to start off with how you're going to go into this program. But at the outset, I would like to say what this program is exactly like, because the allied health sciences uh, programs in this institute and across the world are many. And B.Sc Operation Theatre Technology is a program which is designed in such a way that our students are trained in all aspects of Operation Theatre Technology. They are not going to merely man and say that we are technologists, we are in the operation theater, but they can sink into multiple roles, because when you pass out from this institution, your role is going to be multiple because of your training, which I don't think you'll get in any other institution across the country, excepting the institutes of excellence. When you consider, especially the All India institutes, or you consider other nationally ranked private universities or colleges. So, on that note, I would like to say that Operation Theatre Technology is a course which is going to prepare you into this program in such a way that you gel into a teamwork persona rather than being an individual, but you're going to gel into a teamwork. So, in such a way, we are going to train you, in such a way, we're going to mold you that you are always ahead of others. So, the Operation Theatre Technology here is a part of the Allied Health Sciences group, and entry is always based on entrance examination of the institution, which is competitive. And if you get into this program, your program is going to be spanned out into 4 years. So the 4 years of training would be again divided into 3 years of curriculum, academics, examinations, and the fourth year would be internship. Internship in the sense that you would be rigorously put into different operation theaters where you will be trained into a person who's going to master the techniques of that particular operation theater or that particular specialty where you're going to go into. And you're going to evolve in such a way that you're going to become confident enough when you come out of that. So your training is going to be everything bundled into one. You're not going to be completely a bookworm, but you're going to be a person who has got skills which are very, very essential for life, which have got skills which are very essential for your practical professional application, and also for practical living as a person in the society. So that is the first part which I want to highlight. Once you are into the program, you will be enrolled as B.Sc Operation Theatre Technology students. And once into the program, you have 3 years of academic training. The 3 years of academic training also includes uh, real-time practical involvement. It is not that it is fully academic, because the first year you're going to go into basic sciences, which is very necessary for any health study. So the academic training in the first year would involve your basic sciences such as anatomy, physiology, biochemistry, and then you would subsequently graduate yourself if you pass the examination, university examination in the second year, where you are trained in pharmacology and of course other related paramedical subjects. And with that, you are going to be put into different broad specialty theaters. Along with the broad specialty theaters, you would be put into different sectors of this vast university teaching hospital setup, where you will be posted in the central sterilization and supply department. You'll be posted in the blood bank. You'll be posted in different areas such as the medical gas manufacturing plant here. You'll be posted in different areas such as the broad specialty theaters, the surgery, ENT, ophthalmology, orthopedics. So you're going to go into different theaters, and also some part of it might be involving or amalgamating with super specialty theaters like GI surgery, plastic surgery, robotic surgery, and all those things would be gelling you and showing you how things work out here. So at the beginning of this theater program, I would like to tell you that Amrita is a marvelous center for excellence. It is not just a center of teaching, but it's a center for excellence in medical care where everyone contributes. Why we are calling it a center of excellence is because we have got landmark publications. Number one, we have got equipments which are necessary for treating patients. Thirdly, we are going to have doctors who are world class, arguably, because the cases which come here are mostly uh, the tertiary care referral hospital cases where twice or thrice or four times. They've been rejected by other hospitals across the state and across the country. And when they come here, they are expectant that some marvel is going to happen. And lo and behold, all these patients go very much satisfied and completely cured of the disease if it is a curable disease. So that part of it is rest assured. And when you come in, you will see the state of the art equipments here. You talk about electron microscopes, we got more than one. If you talk about cutting edge robotic theaters, we got more than one. If you talk about cutting edge robotics, which is the latest, we got more than one. If you talk about magnetic resonance imaging, we got more than one, especially the silent MRIs, which are there, which is hardly there in very few institutions. And then, of course, you have the PET, positron emission tomography imaging. And then we've got a very good nuclear medicine department, which is there only in one or two centers in the state. Forget about the country. Of course, country there are very few centers which caters to the patients coming to nuclear medicine department, because these are all radioisotopes which are brought in from our radioisotope centers across the country, especially like Mumbai. So that is also used for diagnosis of diseases and treatment of diseases. And of course, with that, you have other areas of treatment excellence, especially gamma knife, which is called as stereotactic radiosurgery, where you don't use a knife practically, but you use high precision radiation beams, gamma radiation beams, to target the tumor and kill the tumor with very little collateral damage to the adjacent tissues. So this actually facility is available only in a few centers across South India. I don't think any centers other than our centers of cancer excellence, especially in our state and across the South Indian region, would have a gamma knife. So on such platform, you're going to get trained. And when you're trained, you will be seeing that you are completely utilizing these facilities. And as a student, you've got all authority to go and see and participate in all the treatment processes, the workup of the patients, the transport of the patients, and of course, finally, when the patient comes and tells you the outcome, that is more satisfying than anything else. So that's very, very important. Now, coming to the third year of your training, again, you will have exclusive theater postings. And these theater postings are going to set you apart, because you will be trained in the rigors of being a person who's going to be in the operation theater. Especially punctuality is taken very important aspect and care of. And they see that you come into the theater at the right time, because theater begins sharp at morning 8 o'clock. If at all you're there, not there. And of course, and then it continues till late evening, late night. As a student, you will be given all your leaves and all the working environment and learning environment which is required of you. But your intent is very, very important for that, because you will have to have an intent that you have come here to study. So you will have to have the intent that you're going to learn even practically when you are in the operation theaters. So everything is there in the operation theater. We have almost 30 or more than 30 operation theaters running simultaneously. I am telling you, it's not 1 3, it is 30. Every day, when you enter into the receiving areas, you will feel that it is a mass of patients who are going to the theaters. Hardly you will get such an environment. Hardly you will get such an environment when you're coming into such a place. So one of the things which is very, very important is that you should be trending yourself into such a scenario that you have to gel into this. So you have to train yourself so that you don't feel that you're left out. But these all things will be subsequently done when you are into the system. So you'll be a part of the system which will nurture you and bring you the best and bring the best out of you also. So that's very, very important. Along with this, I want to very much reaffirm, as I told you earlier, we have cutting edge research and landmark publications. Of course, for that, you students are also part of the chunk which is going to do research. So all the students who are going to B.Sc Operation Theatre Technology have to do a research project, which is mandatory and part of the fulfilling criteria for you to appear for the final B.Sc Operation Theatre Technology University exam. So that's very, very important. You will have to choose a subject in your second year of your career, especially in the Operation Theatre Technology program, and you'll have to work on it and do research real time. You have to get the protocol submitted. You'll have to get the protocol worked out and cleared by the ethics committee and the review committee. Then you'll have to get the research done by yourself. You have to write up the thesis or the dissertation, and you'll have to get it signed by your program head and also the principal uh, before you appear for your final Operation Theatre Technology University exam. So this is a part mandatory to the completion of your certificate which you are going to get. If you're not completing your thesis, not going to write your exam in the final year. So that's very, very important. So we take much care that you do cutting edge research. And mind you, this is not the superficial. All this research is done in very high end specialties, neurosurgical specialties, plastic surgeries, GI surgeries, general surgeries, orthopedic surgeries, all these research topics and landmarks. If you come and see a research dissertation here, it is equivalent to any medical research which is done across the world. So another thing which we want to emphasize is when you're doing a research, when you're doing a dissertation, all of you should be able to publish it when you pass out of this institution. Publication is very, very important. So publication in journals, especially national and international journals of repute, are a mandatory thing. So you'll have to take efforts to see that you publish your research work. And that is also very, very important for you. So that is also going to make you more skilled, and that is going to make you more into research oriented category. And when you pass out of this with a publication in your hand, you are far apart the rat race. Especially you have uh, crossed a barrier where you don't stay with the students who pass out in B.Sc Operation Theatre Technology from other institutes. You have a publication which is a research publication of your own. So if at all you're seeking a job prospect in the country or outside the country, you stand well apart the crowd. So that is very, very important. So we emphasize on that aspect of your training also. So mind you, research also is a part of it. So your thesis is a mandatory part of your curriculum. So having said that, don't get disheartened. All our graduates who passed out have been fully employed till now. All our graduates who passed out have been fully employed till now. The previous two batches, almost all of them, and one or two of them have gone abroad for further studies also. So that's very, very important. So you have very good job prospects waiting for you, especially to talk about the Middle East, you talk about the European countries, you talk about the Americas. So your job prospects are also very wide when you pass out this institution. We take care that you are the best of the best in this country, also the best of the best in the world. And especially when you pass out from Amrita, you're carrying a brand value and a brand name with you that you are going to be an alumni of Amrita. So we take special interest that once you pass out, you enroll yourself as an alumni member, and we can connect to you across the globe wherever you go. And the alumni relationship is very, very strong, and it is growing and reaching far and wide across the world and the country. So you are going to be a part of the privileged class where you are exclusively privileged to be in different aspects and in different ways unique to other unique than others who are passing out the same program in other universities. So that is very, very important. So you should all know that it is going to be a program which is if you want to study further and if you want to increase your knowledge base and if you want to specialize in you can further study here also. This is a university teaching hospital. You've got all courses related, or you can very well do, or if you're good enough and you see that you are academics here, we can also help you in doing that. So there are a lot of prospects which are hanging out enough to study. You should be sincere enough to work, and you should be sincere enough to do. So all these are there, and mind you, all work and completely stressing on academics only. We in this institution give equal importance to so all the extracurricular activities which are there in other institutions and which are there for you also. You'll be involving yourself in arts fest, you'll be involving yourself in sports, you'll be involving yourself in different conferences which are there, which are required for you. Going into the extracurricular field, your extra right
Sorry, doctor, your
because we
voice
give
is breaking
exclusive
in
leaves
between.
for such days.
Voice is breaking in between.
Hello?
In between, your voice was breaking, doctor. Maybe it's a connection. Yes.
Probably. Yeah. Can you hear me now?
Yes, yes, doctor.
Yeah. So I hope I can be heard.
Yes, doctor. Now we can hear you.
Okay. So extracurricular activities also given equal importance. So in the sense that you will be involving yourselves in arts fest, in cultural fests, in all other festivals which are required, so that you are a complete person when you pass out of this institution. So rest of it taken care that you are going to be involved in lot of activities academically and extracurriculum wise also. So you're not going to be dull at all. So we take complete care of you. You are going to be an individual who is going to be a complete amalgamated person professionally, personally, and ethically. So I hope that all of you will do well when you come into this institution. If and but if you choose, and we are here to always help you, and we are here to help you further in going across for your job prospects also if you require, or for your uh, further studies if you would require any help in that matter. But you have to have the intent for that. That is very, very important. So if you have any further questions, you can ask me. I'm here to clarify your doubts. And then we are always here to clarify your queries, and any suggestions you have, you can also give us so that we can further take ahead. So please, I think I am sufficient as for now. Thank you very much.
Thank you, doctor, so much for that wonderful talk that you have given. And I'm sure this has enlightened the attendees who have attended this webinar today about this Operation Theatre Technology, a chance for their research, awareness of all the modern tools and technologies that we use here in Amrita. So this clearly tells you, like what doctor has so clearly made it, it's very clear that why you should actually choose Amrita, this institution, especially for this particular course and all other courses that we have over here. We have the same kind of credibility that doctor has shared today with all of you. So doctor, we will be listening to any of their doubts, but before that, doctor, let me ask you just one or two questions, like how these attendees who are here in this webinar, how should they prepare themselves before they join the course? Like what should their mindset be, or what are the things that they should be prepared with before they join this course in Operation Theatre Technology?
Of course, first of all, they have to go through the entrance exam, which is very important. They should be trained in all the science subjects and also in English also. So that's very, very important. So once they are through the entrance exam, they will be coming into this institute. And then once they come here, of course, first thing is they have to know that we are not an institution which is only going to deal with academics. We are an institution which we take students and mold them in such a way they are good human beings, good professionals, and good people who are going to go into the society. So, as far as academics is concerned, we give them all sorts of support which is required, especially in their teaching schedule, in the practicals, in operation theater rounds, and all other things where they go to get posted. Along with that, they have other postings in other allied health places where I told you earlier, like the Central Sterile Supply Department, or you talk about the blood bank, or you talk about the other facilities which are there only in institutions like this, like the gas plants or the facilities plant, all these areas they have to rotate. So they will be going across all these departments. And initially they will come in as a student and they will be almost at par with the medical students who are here. They go into anatomy, physiology, biochemistry. They are also taught the same subjects when they come here. And then, of course, the paramedical sports, the subjects are also the same. And once they go through that, then you have the advancement coming into the specifics of operation theater technology, like basics of operation theater technology, principles of anesthesia, advanced operation theater technology. So there are different papers, and as you go across, you clear each of these papers and you go across all the years. And then once you pass out all the three and a half year, 3 years, you come for 1 year of internship. Internship, you won't have much of an assessment protocol as such, but you would be assessed in all your learning skills, what you've learned. So you have to be in a phase where every time there is formative assessment and summative assessment, even in internship. So you have to be prepared that whatever you've learned, you might be asked for a viva voice or a examination where you'll have to uh, produce what you've learned in front of the faculty or the other people who are there, especially the doctors who are training you. So that is also part of the curriculum. So
Okay.
along with that, don't think that we are going to task you much by doing all these things. You're going to get adequate time to recoup yourselves. You'll get adequate energy so that you sort of play. You are a complete person. So we give adequate importance for that also. So don't think that we are going to tax you with all the academics and all the theater work. No, you will be treated across the board as it is required. So that is very, very important.
Okay, thank you, doctors. They have, so that means they have different job roles here once they join
Yeah.
this course. Okay,
Yes.
doctor. Some of the parents have come to us. They keep telling like the child, their child is afraid when they see blood, or they have to be for a long time in the AC rooms and all that. So is this like kind of hindrance to any of their passion for this particular program?
Yeah, very good. That's a very good question. So I would like to say that, of course, even when we started our career as students, even any body fluid for that matter, which is being taken up from the body, would cause you a thing called a vasovagal attack. Initially, you will have a feeling that everything is dark around you. But for you to be initiated into something, there will be a phase where you will have to get acclimatized to that. So suddenly, when you go from a hot environment to a very cold environment, you will have to have jackets for that. But mind you, after the initial acclimatization, you will be a part of it. Rather, you will feel that that is normal. Like being in the air conditioned operation theater won't make you abnormal. Rather, you will feel abnormal when you come to the normal room temperature from the ICs. So uh, that is just a myth which is there among students. So nothing to worry about that, because it is going to be a part of your life. So of course, everything is correct that initially you will feel a bit afraid when you see blood, but you will get the students are going to get acclimatized to that. There is no doubt about that, because everyone has got, even a medical student who comes into third year of the clinical practice, when they see the patient's blood being drawn, some of them faint. So that doesn't mean that he or she is going to discontinue the course. No, they will continue, because only fainting will happen once. After that, they will be all right. Okay, even the postgraduates who come into operation theaters, the first day they have giddiness, then they have some sort of a vasovagal syncope type of a reaction. But after that, they are normal, because that is the initiation into their career. So after that, everything seems normal for them. So I assure you that is not going to be a hindrance to their course any further. So that
Okay.
is rest assured.
Yeah, thank you so much, doctor, for that information, because some parents have come asking us all these questions. So,
Yeah,
doctor, we let them raise their doubts. Meanwhile,
yeah,
we have Shanley from our admissions team who will just guide these attendees through the admission process for this year.
sure.
Shanley, can you?
Thank you, ma'am. I'm Shanley from Cochin Admission Office, Amrita Institute of Medical Sciences. So I'll be explaining you the admission procedure for B.Sc Operation Theatre Technology. As you all know, Amrita Institute of Medical Sciences Kochi offers various allied health sciences courses, around 17 in number, and B.Sc Operation Theatre Technology is one among that. As Sir said, the duration of the program is 4 year, in which you have to do a 1 year compulsory internship in the final year. The eligibility of the program will be you have to attend Amrita entrance examination life science and also thereafter an online interview. The age limit is the candidate should be between 17 years old and 23 years of old as of the academic year. And regarding the academic eligibility, the student should pass physics, chemistry, biology with an aggregate of 60%. The admission can be obtained through three different categories: scholarship, non scholarship, and NRI. So, as you can see, the tuition fees for the scholarship category is rupees 1,10,000. For non scholarship, it is rupees 1,40,000. And in NRI, it is USD 3,000. There will be another fees in the first year, which is around 41,000, and admission processing charge for the first year. It will be charged only in the first year. It will be around 2,500, and hostel and mess fee will be around rupees 80,000 per year. The selection is made through Amrita entrance examination, life science, agriculture, and medical sciences, which is in short named as AEL. The examination date, tentatively, it will be in the third week of May 2025, and it will be conducted in 3 slots: morning, afternoon, and post noon. So each candidate will have a facility to select the examination date and slot. So as you have already registered, you have to frequently check your mail which you have registered, because the slot booking facility option will start maybe around the first or second week of May. So all the candidates will be getting a reminder mail regarding the slot booking. So that time, through the link provided in the mail, you have to select the date and slot. So once the slot booking is opened, uh, and after completing the slot booking, you will be able to download the admit card. The question paper pattern will be like this as shown in the screen. The examination will be a computer-based test in the allotted centers. Already you have given 3 city preferences. The city will be allotted based on the number of candidates and the slot or date you are choosing. The total duration of the exam will be 2 hours, which consists of total 80 questions, 25 from each physics, chemistry, and biology, and 5 from English. The total marks will be 240. The examination will be a multiple choice question. Please take note of this website and portal, which is very useful for the candidates. The admission website, amrita.edu/admissions. The AEL website, amrita.edu/admissions/AEL, where the updates regarding the entrance examination is already updated. And the UG portal, applyug.amrita.edu. And also remember your registered email ID and password throughout the admission process. And please note that this applyug.amrita.edu is the only portal, other than for the beta courses, this is the only portal for applying for the UG courses in Amrita Vishwavidyapeetham. So this is the registration website, applyug.amrita.edu. So as you can see, this is the first stage of registration. You can, if you are a fresh candidate, you can register by giving your name, mail ID, and mobile number. And if you are already registered, you can log in using your registered mail ID and password. As you move forward, you have to fill your personal details. And in the next step, all the campus of the Amrita Vishwavidyapeetham is shown. And to the right side of the pane, the UG courses conducted in each campus is shown. So here you can see in Kochi campus, Operation Theatre Technology is shown. and admission is based on AL rank and interview. So if you are interested, you can apply. So while moving on, you'll be asked for the city preferences. You can update 3 city preference and you can continue with the payment of rupees 550. So please note that this is a common payment for the courses which comes under the Amrita Entrance Examination Life Sciences. In the portal, in this UG portal, other courses are also there, which is not included in the life sciences. So for those courses, you have to pay extra amount. So we have multiple payment options. So do it accordingly. And after doing the payment, you are asked to update your 10 percentage and the details regarding your 12th results. Since most of you will be awaiting your results, you can choose the option awaiting. And once if your results are declared by the last week of May, you are supposed to log into this website again and you will be asked to enter the marks of physics, chemistry, biology, and also in the next document upload sessions. Currently, you can upload those documents which are available right now with you. So once the results are declared, you are asked to upload a copy of your final marks card of 12. So regarding the slot booking for AEL, mostly as I said, maybe the second week of May or the first week of May, a notification will be given to your registered mail ID. So it is important for all the candidates to frequently check your mail ID. There will be a link provided in your mail ID. Using that link, you can move forward, select the slot and date of the entrance examination. Please note that the allotment of date or slot will be on a first come, first service basis. Suppose if you are not exercising your option, automatically a date and slot will be allotted to you. So after completing all the stages of the registration, the candidate will receive a confirmation mail including your registration number, which you have already got. So save your registration number, registered mail ID and password for the future reference. If at all you have any queries regarding the admission process, you can contact the numbers given in the screen or you can send your queries to ugadmissions@aims.amrita.edu. And the parents and candidates be aware that the university has not appointed any third party or any other external agents for acquiring admission in Amrita Vishwavidyapeetham. So be aware and contact only the numbers which is given in the website and or else the mail ID which is given in the website. Thank you.
Thank you, Shanley. That was very good detailing about the whole admission process. Now, regarding the marks for the exam, it is 240, but for each of the exam, for the each of the questions, Shanley, can you tell them how many marks is shared for the right answer? And
3 marks will be provided for the right answer and -1 for the wrong answer.
okay, that's fine. Sir, there is
Yeah, please tell me.
so there is one person I think who had just joined. In just 2 or 3 sentences, could you just sum up the program because they could join only late. Just
Okay.
3 or 4 sentences.
Yeah. So just I would like to tell whoever joined late, just a recap of what I've told you in a nutshell. Uh, Amrita University itself is a brand name. So once you're going to join here, you're going to come out with a brand name with you, and then the certificate carries a lot of weight across the country and across the world. That is the first thing I want to tell you. And regarding this program, once you enter the B.Sc Operation Theatre Technology, it is a 4-year program where 3 years you're going to go through the rigors of academics. The first year would be basic sciences. The second year would be paramedical sciences, along with the introduction to your Operation Theatre Technology program, where you're going to have theaters being rotated for you. Especially when you consider theaters at ENT, ophthalmology, general surgery, orthopedics, gynecology, all these theaters would be going through your curriculum where you have to take postings in this. Then you will be rotated through a lot of other departments which are new and which are only exclusively available in this department, especially robotic theaters. You have the central sterilization and supply department. Then you have the blood bank, which is a state of the art where you have component separation and other storage methods, different ways of seeing how blood is collected, blood is stored, how different components are separated, how they are transfused. Uh, then you go across different facilities which are very, very important for a hospital, like the gas absorption plant, the medical gas manufacturing plant. Where you are given more of a training into how to sort of deal with such allied departments, especially the sterilization. When you talk about, you have to talk about the waste disposal part also. So you'll be taken to different incinerator plants and other areas where you have the recycling going on. All those things would be added to your curriculum. And the third year would be exclusively for you in the theaters, where you'll be rotating in different theaters and then assigned to one particular theater, and that comes across different specialties and super specialties: plastic surgery, head and neck surgery, surgical oncology. You come across transplantation surgeries. These are all exclusively for this, present only on this hospital, especially when you talk about different transplants. We have the heart transplant program going, the pancreas, the liver transplant programs going, are the upper limb transplantation programs, which is exclusively there only in a few centers in this country, and for that matter, Southeast Asia. So you will be trained and brought into different operating domains where you can exclusively see this. You can see the cutting edge robots which are there. You can see the high end equipments which are there, especially the gamma camera, the cyber knives, the nuclear medicine imaging, the PET imaging, the high intensity MRI machines, the 3 Tesla MRIs, the PET MRIs. So all these things are only present in institutions like these, which are university teaching hospital of world class repute. And of course, we are a center of excellence in training students in these high end technologies also. So you will have exclusive privilege and access to these areas which are not there for other B.Sc Operation Theatre Technology students across the country. So you will be a privileged class of students who are going to get trained in this. And along with it, having said that, you're going to be trained in research methodology, because dissertation submission is a part of your fulfillment to write the final university professional B.Sc Operation Theatre Technology exam. So you'll have to write a dissertation, choosing a subject in different specialties or super specialties, and you'll have to submit your thesis to the principal's office before you appear for your final year university exams. And now we're making it mandatory that you write a paper and you try to publish it before you appear for exams. So by the time you finish your 1 year internship, you will be fit enough to be publishing your dissertation. So that is also going to be made mandatory. So along with that, you have other activities in research also. You name it, you will get it. Wherever you talk about DNA splicing, you talk about CAR cell therapy in cancer chemotherapy, you talk about monoclonal antibodies, you talk about harvesting of bone marrow. Everything is there in the institution. And as I said earlier, you will be the exclusively privileged class of students who are going to witness all these things if you become a student of this wonderful university teaching hospital. So along with that, we're not going to leave you like that. We're going to see that you are entertained and kept very well physically and mentally also. So you will be given access to sports, to gymnasiums. You'll be given different festivals to thrive upon and memorize your life in this institution. The arts fest, the cultural fest, all this will be across days, across weeks. So there also you have a broad spectrum of activity coming. So you will be a complete person by the time you pass out. And of course, everything within the ethical standards which are prescribed for you. And by the time you come out, you're going to be a very good human being. You're going to be a very good professional. You're going to be a world-class student. And you have a brand value with you that you're going to be carrying with you. That is, you're from Amrita Institute, and you will be recognized the world over leave about only this country. So that is what Amrita is all about as far as your course is concerned. Thank you.
Thank you so much, sir, Doctor, for spending all this time and answering them again. I hope Rinsha and the latecomers are happy now. Doctor has once again summarized the whole aspect for you. Doctor, there is Akshara who has raised hand. Let us ask her what is her doubt. Akshara, can you unmute and Akshara, you have any doubt? You could unmute. She's not answering to us.
Yeah. Students can feel free to ask any questions. Please don't hesitate or don't
Yes.
feel shy.
Yes.
We are here to answer all types of questions. Don't think that your questions are going to be irrelevant. Every student is brilliant enough to ask very good
Sir?
questions. So don't think. Yeah, please feel
Yes,
free.
Akshara.
Does the OT technologist can work under cesarean section?
You will be posted. Initially, yes, definitely. You will be posted to all these theaters.
Okay,
Yes.
Because
thank
your
you, sir.
training also is a part of that. Yes.
Yes, so okay, Akshara, thanks for your question and doctor for that answering. Any other doubts? Doctor, this was really a very clear and crispy talk this year. We are so happy that you have taken such a lot of time from your busy schedule to be with us for this webinar. So it's been a pleasure to have you with us today again. And I also want to express my heartfelt gratitude to you and each one of our attendees who have attended this session throughout. So this brings us, I hope, no more doubts. So I think we could end up today's webinar. So we hope you found the information very interesting and beneficial also. So thank you all once again. And we wish to see you all soon in our campus with such good expert doctors with us, like Dr. George. Thank you, Doctor, once again, and take
Thank
care.
you. My pleasure. Thank you very much.
So we shall wind up the webinar for today. Thank you.